did at the beginning, they did some data input where each of us voted from a little gadget that we had, and then that was entered with the data from around the nation, so you saw the national averages in terms of who was attending. It was overwhelmingly Caucasian. It was a majority of men. The incomes were actually on the high end, which was interesting. But in terms of political views, it was primarily center-left, which was interesting. And then it was interesting when they went into the values section, they really pitted choices that you didn't, they pitted like as if there were only two choices. Either you believed in government or you believed in individuality, and it felt like they were asking us to make decisions that didn't make sense. And it was interesting in the one area where they asked us to make that decision about, do we believe that the government should take care of the most vulnerable or people should be more individual? During the time period when people were voting, they played the song All By Myself. It felt very surreal, as if we were trying to be influenced in a subtle way. Although we sat at tables, the decisions were entered really in an individual manner, and it did not really lead to a broad, large group discussion. It was a small group discussion that was really highly scripted and on a very structured time schedule, so that sometimes people didn't have time to finish the discussions that they were having and were forced to make a decision. But I did have a chance to glance at the people who put together these options workbook, and saw that is, groups like the American Enterprise, the AARP, Brookings Institution, Heritage Foundation. There are a number of organizations on here who favor more of a privatization approach, and that I think the content, in particular for my area of expertise for healthcare, I was very dissatisfied with the information in there and felt that it was very misleading. In the ways to make cuts, they put 4 broad categories of healthcare: Social Security, non-defense spending, and defense spending. The options that are given to make changes to the Social Security are not ideal options. They're options that cut or privatize Social Security and put an increased burden on the working class families. For instance, the solution which would be optimal when it comes to Social Security, which by the way is solvent and is not at risk right now of having problems even up into the next 30 years. They don't mention raising the proportion of tax that's paid by those in upper income brackets, which would be a solution that would be a progressive way of handling any future difficulties with Social Security. In terms of defense spending, you're given the option to cut the spending by as much as 15%, but they really downplay the role of defense spending as a problem in our country. And so, for instance, those of us who would support a much higher cut in defense spending to put us in line with other nations around the world so that we could use that money for social programs, don't have that option through this. And then raising the revenues, again, it's often the choices revealed were things like value-added taxes, carbon taxes, which put the burden on working families, removing tax credits and deductions. They did, to their credit, have options for raising taxes on the wealthy. This format, compared to the U.S. Social Forum, they felt like very opposite ends of the spectrum, because here at the Social Forum, there's a concentrated effort to make all voices be heard, space for people to take the time that they need to speak their mind, a real respect and lifting up of those who have not had a voice previously. And this was a very tightly scripted. I have strong concerns that we're going to see a similar situation to what happened in the health reform process, where they make it appear as if they're having a debate with the American public and educating the American public, but then they're going to take this data, which is being collected in a biased fashion, and use that to reinforce their agenda, which is to cut our social insurance programs when we know that we do not need to balance our budget on the backs of our social insurance, that will actually be harmful to our people, and that there are other ways that we can control our deficit in terms of reducing our military spending, greater tax input from our corporations would be another big one, more progressive taxation of our people. These are things that would be a more just way to solve our deficit problem.